This public plan, is this non-negotiable? Would you sign a health care bill without it?
I think that there's going to be some healthy debates in Congress about the shape that this takes. I think there can be some legitimate concerns on the part of private insurers that if any public plan is simply being subsidized by taxpayers endlessly, that over time they can't compete with the government just printing money. So there are going to be some, I think, legitimate debates to be had about how this private plan takes shape. You know, there are polls out that show that 70 or 80% of Americans are satisfied with the health insurance that they currently have. The only problem is that premiums have been doubling every 9 years, going up 3 times faster than wages. The U.S. government is not going to be able to afford Medicare and Medicaid on its current trajectory. So now, the public plan, I think, is an important tool to discipline insurance companies. What we've said is, under our proposal, let's have a system the same way that federal employees do, same way that members of Congress do, where we call it an exchange, but you can call it a marketplace, where essentially you've got a whole bunch of different plans. If you like your plan and you like your doctor, you won't have to do a thing. You keep your plan. You keep your doctor. If your employer is providing you good health insurance, terrific. We're not going to mess with it. But if you're a small business person, if the insurance that's being offered is something you can't afford, if you want to shop for a better price, then you can go to this exchange, this marketplace, and you can look, okay, this is how much this plan costs, this is how much that plan costs, this is what the coverage is like, this is what fits for my family. As one of those options, for us to be able to say, here's a public option that's not profit-driven, that can keep down administrative costs, and that provides you good quality care for a reasonable price, as one of the options for you to choose, I think that makes sense.